My name is Teresa Gomez Lancedale. I'm an occupational therapist. I'm currently also, I've been practicing for 30 years, and I'm also in a advanced certification program for family and marriage therapy. And I'm going to go ahead and say it in Spanish for anyone that might be out there that is in our Spanish-speaking audience. So, me llamo María Teresa Gómez Lancedale. Soy una terapista ocupacional que estoy trabajando en un certificado avanzado también para terapia familiar y de parejas.
You had mentioned that you work with ASU Prep, a program for kindergarten to 12th grade, and that you see many children who have dual exceptionalities, like ADD or autism, with a high IQ, as you so put it. Will you please tell me more about your current experience working with these children?
Absolutely. So during the pandemic, you know, so many of our lives changed, right? And so what happened with me in particular is I was working for the VA, and what happened is my mom ended up having breast cancer. And so because it was during the pandemic and I was living in Texas, I had to kind of make a choice. And first I did FMLA, and I realized very soon that my mom was going to need more care, and I wasn't going to be able to continue that, you know, being physically not in Florida. And so I took a little hiatus, you know, went and took care of her for about 6 weeks. And then after that, I decided to move to Mexico we have a ranch in Mexico, and I started working online. After I started working online, I realized how much I loved it. We landed in South Texas, and but when I was experimenting with doing therapy over what we call teletherapy, I realized how much I liked it and how much flexibility it gave me to be able to be in either Florida or Texas, because my mom's health wasn't like 100%. And along comes ASU. I'm going to give them a plug because I love them so much. ASU Prep Digital. And so that's a charter school through ASU. And originally they were, they serviced the kids from the high school kids. And what they were hoping to do was that these kids would then be able to be dual enrolled, taking some ASU courses, and then transition right into the university. And I think that they were open like 1 or 2 years prior to the pandemic. So then comes the pandemic, and they decide, hey, this is a great opportunity to open up the curriculum from K through 12. And what my role is as an occupational therapist, and I would say probably about 80% of my students are what we call dual exceptionality. So what does that mean? That means that they are gifted in some way, but that they also have some, most of the time it's either attention deficit disorder or autism. And I love it. I love it because being in a digital environment kind of takes away a lot of the anxiety that some of these kids have, a lot of the behaviors that they have. And because the programming is already tailored to higher education, our teachers are amazing. And our motto actually is all kids can. And so it really resonates the ability to say, like, let's not put any expectations or any limits on our future generations, and let's see what we can do now so that we create, you know, a better world. I mean, that's how I look at it. So I'm going to go into my Spanish now. Ahorita trabajo para la Universidad de Arizona. Tengo 3 años trabajando con ellos. También estoy trabajando en unas certificaciones de especialidad, bueno, esto no importa, perdón. Y trabajo, la mayoría de mis estudiantes, como te dijera, como 80% de mis estudiantes tienen lo que se dice dual excepcionalidad. ¿Qué quiere decir eso? quiere decir que tienen un IQ más alto, pero que también puede que tengan un tipo de neurodiversidad, o también puede que tengan mm, la cosa vascular. A lo que voy es que es un programa muy bonito, porque el énfasis de ese programa es de que todos los niños pueden, y entonces no hay barreras. Y parte de mi trabajo es de ayudar a estos estudiantes seguir para arriba, dándoles todas las oportunidades, y de cuando terminen la prepa con nosotros, que automáticamente se empiecen a ir a la universidad.
Why do you think there is such a significant rise in ADD and autism? What environmental factors do you believe have contributed to the rise?
I mean, it's very interesting, right? So we know that attention deficit disorder and some autism disorders are genetic. It is the highest. Attention deficit disorder is one of the highest genetically imposed disorders. So I don't know if it's like that there's a more popular, I'm not sure if it's like that we're identifying more. I think at one point, probably in the 90s, they were like overdiagnosed. I felt like they were overdiagnosing attention deficit disorder. But also, there is like a thought out there, and I can't really tell you that it's research, that it's 100% research based, but there is a thought out there that the higher cortisol, like that as a society, we're living with higher cortisol levels, and that could potentially be creating some increased neurodiversity in our children. Oh, I can't say 100% that that's truly research based, but there is that theory out there. I wonder if I should say that question in Spanish before I answer it. La pregunta era, ¿por qué crees que dicen que hay números más grandes en déficit de atención y autismo? ¿Crees tú que hay cosas que pasan en el bien ambiente que puede que sea parte de la razón? Y la verdad es que sí hay una teoría o un pensamiento que dice que por el tipo de vida que vivimos, que hay como tanto cortisol, tanto estrés en nuestros cuerpos, que eso está manifestando más autismo y más TDA. Pero no hay suficiente evidencia científica para realmente decir que eso es lo que es. Lo que sí sabemos es que el TDA o déficit de atención es una de las enfermedades que son genéticamente más cruzadas.
What inspired your transition from psychiatric rehabilitation to cognitive rehabilitation? And how has this shift influenced your therapeutic approach?
That is like such a great question. Like how like some of the focus in my career went, and this is when I was originally working for the VA, and this was like in the cusp of OEF, OIF, and which I'm sure you're familiar with those acronyms. I'm trying to remember what exactly they stand for at this point. Operation Freedom and then Enduring Freedom, I think, is something like that. And what was happening was I was working with the chronically ill in the psychiatric unit. But my coworker was working in a program where she would get patients coming in with severe PTSD, and it was a 3-week program. And she was having a really hard time with some of her guys, and she knew that prior to that, I worked in the schools. So I worked in the schools for the first maybe 15 years of my life. I did a couple of different things, but primarily pediatrics. My husband had to move with his job. The VA was the first job that I found. So I took there, that position had been closed for 18 months. Nobody wanted to do psychiatric rehab. But I wanted a decent job. And so I just went ahead and took the challenge on. And so she's like, these people are, I feel like some of these soldiers are presenting like they have a learning disability. And so when I started working with them, I realized that these were all, when I started looking at the data, I realized that all of them were blast injuries. And so with a psychologist who, you know, he's actually younger than me, but we grew together in that program. I said, I have a feeling that this is potentially blast-induced attention deficit disorder. And so what happens is we started doing some research together and different strategies that would work for some of these guys, and there's a theoretical technique in occupational therapy that's called sensory integration. And so along with that, they asked me to present at a national conference. So I go and I speak at the national conference, and my soon-to-be boss and the clinical director came up to me after I was speaking, and they said, we're opening up a brand new program in San Antonio, and we think that you would be a wonderful asset to our team. Will you come and interview? I was living in Houston at the time, and I really did love San Antonio. And I thought, well, why not? And so it was a catalyst for growth and for me professionally, because what the program director did is he handpicked all these different clinicians, and there was only 5 programs in the nation. We were the 5th to open the community integration program. And so because we were expected, because it was funded by both Department of Defense and VA, there's certain expectations under that funding. So we have to do research. And so I learned how to do research. I learned how to be able to, whatever I was doing functionally, to apply at a research level, and the other way around too. And it was an amazing time for me, because I was able to really grow as a professional, and just really fell in love at that time with cognitive rehab, what blast injuries did to the brain, how PTSD was entwined in that. And, you know, something else that you and I have talked offhand, how the certain programming that happens in the military can affect rehab outcomes. The best way that I can say that. And so I'll go ahead and translate that to Spanish and give it in Spanish. So Victoria me está preguntando cómo es de que, porque ella sabe que yo estaba practicando algún tiempo en psiquiatría, qué es lo que me hizo cambiar el pie de mi carrera a la práctica cognitiva. Y lo que fue es que yo estaba en ese tiempo trabajando para el departamento de veteranos, y estábamos viendo que muchos muchachos estaban regresando que había bombas alrededor de ellos, y no estaban aprendiendo el tipo de terapia para manejar el PTSD en ese tiempo. Y me dice un psicólogo y una terapista, oye, Tere, estamos batallando, sabemos que tú tienes experiencia con TDAH, ¿qué ves aquí? Y entonces lo que vi es que lo que empezamos a ver realmente, porque fue a un nivel nacional, pues te pudiera decir que hasta universal, mundial, que las bombas estaban afectando el cerebro. Eso ya lo habíamos sabido, pero de que el aprendizaje y cómo es que se manifestaban algunos de estos síntomas. Entonces ahí es realmente donde empecé otro rango de mi carrera. Me fui de Houston a San Antonio, un programa nuevo que empezamos y fue un tiempo muy bonito porque aprendí este, aprendí a hacer terapia bajo cosas que eran científicas. El Departamento de Defensa es muy específico cómo quiere que tú les des terapia a los soldados. Entonces, pues aprendí mucho en ese tiempo. Y también quieren que todo lo que estés tú haciendo, que sea a base de ciencia. Entonces, también aprendí lo importante de lo que de practicar con evidencia científica. Es una de las cosas que para mí es súper importante en estos temas, que no nada más queremos decir, vayan y hagan esto, vayan y algo, vayan y hagan aquello, sino que debe de haber algo consistentemente en científica.
What is your approach to developing individualized rehabilitation plans for patients with acquired brain injuries? How do you assess their needs and track progress?
Very good question. So, as a traumatic or acquired brain injury specialist, like there's certain evaluation methods that we use. So I like to really reuse the MOCA, and the MOCA is used throughout different, it's used for cognition. So for example, not only do we use it, it's kind of like what I call a screener. So because it can be done at a doctor's office and it can be done by different professionals. It can be done by a doctor. I'm not sure if maybe nurses with their BSN potentially could do it. Maybe they can't grade it, but they could do it. Neuropsychologists, occupational therapists. So there's a range of different professionals or clinicians that can administer that. And they use it in TBI, and they also use it in other cognitive disorders such as Alzheimer's and dementia. And it gives us a better perspective of then, after that, what else do we have to test? So depending on what we see from the MOCA, we're gonna also do some executive functioning testing. And we might also do some visual testing. We might do some motor testing, because what happens with a TBI is we don't necessarily 100% know. We can see an MRI or we can see a PET scan, but until we do some of this functional testing, we're not really sure where they land. And so that's kind of how we gather information. And I think the other big component, as far as for an occupational therapist, one of the reasons why I really do love this career is because we take a very holistic approach to what's going on. So we're looking at the patient or our client from a medical perspective, but we're also looking at their home environment, at socially what's going on, like the socioeconomic component or psychosocial component as well. So Victoria me estaba preguntando que qué es el tipo de evaluaciones que uso yo cuando viene alguien que trae un accidente cerebral. Y empezamos con un tipo de evaluación que se llama la MOCA, MOCA. Y después nos da diferente tipo de información, que puede que sea visual, puede que sea memoria, puede que sea cómo están aprendiendo cosas nuevas. Después de eso, ya después hacemos eso nos da como un rango de qué es lo que sigue. Entonces, después de eso, puede que cheque cómo funciona el sistema visual, un poco, hay diferentes exámenes para eso, o cómo está participando en déjame pensarle en función ejecutivo. Y también, como mi carrera en México realmente cuando es una terapeuta ocupacional aquí en México, es de desarrollo, pero en Estados Unidos es un poquito más diverso. Entonces también vemos, lo que me encanta de esta carrera es que vemos a nuestro cliente holísticamente, completo, no nada más lo que está pasando médicamente, pero lo que está pasando socialmente, cómo es su ambiente en su casa, es padre, es madre, que es su trabajo, y después ya armamos un plan para ellos. I forgot to tell you that because in the question was about a treatment plan. And I forgot to answer that. So we talked about assessment, but after we take all of this, we do the evaluation and we take a complete psychosocial history. We also look at what is it that they were doing prior to, like, where were they functioning, as a parent? How were they functioning? Maybe a student or career-wise, and where is it that they want to go? So we very much take an individual approach to treatment planning. So based on all of those things, all of that is really part of the assessment. Then we sit, if possible, we're going to sit with the patient and create a treatment plan, because what good is it for me to create goals that for you are not meaningful? And it definitely resonates with me, because there's different things in my life that I find important that my neighbor may not find important. But for me, it might be real important that if I have some kind of medical situation going on, if I'm able to still water my plants, that's important for me. If I'm able to spend time outside, for somebody else, it might be something different. And so it's really important that, if possible, when we're working with adolescents and adults, that we very much take into consideration what's important for that client.
What strategies do you have in regards to working with challenging behaviors in patients with brain injuries or ADHD, ADD, ensuring transformative progressive therapy session?
I think sometimes the biggest challenge can be motivation. So especially with really with children and adults with attention deficit disorder, it's not that they don't know what they need to do. They can tell you what they need to do. It's, actually initiating that task, and so what I really try and hit home with them is, these are baby steps. We're not gonna, I don't want to overburden someone, and I use so many different, I guess, problem solving techniques depending on the individual. So for example, I'll give you an example of a child. So I have a student that has attention deficit disorder. He's 9 years. I think he's going to be 9 this year. I've been working with him for 2 years, and he just gets very easily distracted. Or I'm asking, and we're doing teletherapy, so it's a little hard. It's not like I can say, bring out the chair and say, you need to sit down. All I can do is give him the direction to go ahead and sit down, or to go ahead and pay attention. And so what I created for him since we are using Zoom on the whiteboard, I created a little jar for him. And then I had him pick out different pictures that he might like he picked Pokemon, and he picked gummy bears, and all these different little things. So we created a virtual prize jar for him. And you know, at the beginning, it's kind of like a behavior plan. As a student, you know, oh, you're doing well. Let's see what's going to be the first treat that you're going to put in your, you know, in your prize jar. And, you know, he's very excited to really kind of motivate from the back end with positive reinforcement. And because these kids kind of can be very sensitive, I really try and concentrate on the positive and not even address the negative unless it's becoming very disruptive in our treatment session. For some of my adolescents or young adults, I have them on their own create their goals. So it's something that's meaningful to them. I have them pick a person in their life that is going to help them stay accountable to that. And then I also have them pick short-term and a long-term like goal attainment prize. So, all right, so Victoria, you're going to almost force yourself to work on, I don't know what you might be working on. I don't know, work on video editing, and you're going to do that for an hour. And after an hour, you're going to give yourself the prize of going to Starbucks or going to, you know, making that mocha coffee, whatever it is that you might be doing, but almost like integrate these little bursts of dopamine in your life so that you continue going. And then like some kind of long-term, like once you meet that, okay, so I now finished this, you know, it took me 3 hours, but I finished editing. What is it that I'm going to get to do instead of the Starbucks? I'm going to celebrate by going out for a nice dinner, or I'm going to go for, doesn't always have to be food. It can be, you know, spending time with your best friend, or, you know, or just giving yourself the luxury of like, I'm done with that. So I can't stay up all night if I want to playing video games, whatever. But really try and make it as individualized as possible and meaningful to the person as possible. So Victoria me estaba preguntando que cuando tengo dificultades con algún niño o hasta con un adulto que tiene TDA, ¿qué es lo que hago para que puedan estar participando en las sesiones? Lo que le estaba diciendo, que lo que es súper importante es de poder ver a tu cliente como individual, y qué es lo que que ellos sean parte de tu plan, en que le estás dando como premios. Por ejemplo, uno de mis estudiantes hicimos un botecito virtual. Él escogió diferentes calcas como de Pokémon y Gummy Bears y, ¿cuál es el Roblox? Y cuando él llega a una meta, y una meta chica, como que escribe o practica tus letras 10 minutos, entonces ya le damos un premio. Eso es igual con adultos, o sea, nosotros podemos hacer nuestras metas y darnos premios. Lo que para mí es lo más importante con esto es que veas a tu cliente como individual. Puede que a ti no te importa darte el premio de estar jugando media hora o 1 hora con videojuegos, pero puede que a esa persona sí sea importante. Entonces, no lo que es importante para mí, sino que es importante para mi cliente.
¿Creas un sistema de productividad positiva? ¿Es verdad? O enforcement, like positive enforcement?
Sí, no, es exactamente lo que estamos haciendo, Victoria. Es de que estamos creando un programa de que está recibiendo las cosas positivas, y estamos tratando de enfocarnos en las cosas positivas y no en las cosas negativas, porque la verdad es que no importa quién sea, quieres siempre oír lo bueno que estás haciendo, y a veces es difícil oír lo que no, a la meta que no estás llegando. Algún tiempo ya puede que esas dos cosas se balanceen, que las cosas negativas casi ya no hay, y que vamos subiendo y subiendo con las cosas positivas.
Can you discuss an experience in which deeply knowing about family dynamics played a crucial role in a patient's rehabilitation process?
Absolutely. So I think like there's certain things that are really important. And so um, I was thinking about this. I have so many different ones, but I think like one of the main ones that, really stick out in my mind is a patient that came in that uh, was in the Air Force. He was a captain and went through a divorce. And, he was having like the way that his system metastasized alcohol was causing some big major problems in his life. And it was the divorce that was creating a lot of pain for him. He felt a lot of failure with that. But it became, he was an alcoholic. And so when he came into the clinic, he was very depressed. He was very skinny because he hadn't even really been eating. So he was malnutrition and he had a lot of gastrointestinal issues because of the alcohol use. And so he happened to be Mexican. And I was talking to him like, what's something that's, what is, some people have addictive personalities and have depressive personalities. And so like I think like the divorce just really, really hit him. He actually had started drinking before the divorce, and the reason that the divorce happened was because of the alcoholism. But his biggest like what caused the severity was the loss of his children. And so, it took a long time. He was with us for about 6 months, and I would say it wasn't until about the fourth month of me communicating with his ex-wife to let him be able to have visitation with his children. And so, it's very interesting, right? Because you have to really dive deep into the family dynamic and what's going on and really, really look at the person. And sometimes it takes digging because there's sometimes shame involved with some of these things. And when he started seeing his children again, first it was just supervised visits. Like first it was actually not even that. I have to tell you that first it was FaceTime calls. And so we worked our way up a little bit. It really made all the difference in the world because he felt like, okay, if I can have a relationship with my children, then maybe I can come out of this. So I think that it's super important that we really take a look at, I'm going back to that we look at not just what we're presenting, right? So as an occupational therapist, what was being presented to me, this guy was malnutrition. He hadn't been taking care of himself. It's called activities of daily living. He wasn't even willing or wanting to get out of bed to bathe correctly. And so to be able to get him, like I said, he was with us for 6 months to get him to the point that he was actually, being able to go to the park and push his kid on the swing was a big deal. And so that's kind of, that's one, that was definitely a challenge to kind of find that because he was very closed about it, but we did get there. So I'll go ahead and translate that. Que si puedo hablar de una situación donde es importante de la dinámica familiar y cómo es que eso afectó el proceso de rehabilitación. Y le estaba diciendo a Victoria que pues estaba yo trabajando con un señor, con un veterano, bueno, realmente todavía estaba activamente en el ejército, que era alcohólico, y por por eso mismo fue que se divorció. Entonces no quería participar en nada, no estaba bien flaquito, no estaba comiendo, no estaba bañándose, no quería levantarse, estaba muy deprimido, y también era alcohólico. Entonces, se tomó mucho tiempo de poder, pero llegamos al punto, en varias conversaciones y platicar con su ex esposa de que lo que le dolía más era que no podía ver a sus hijos. O sea, ella y el juez hicieron eso por la situación de que él era alcohólico. Empezamos con cosas muy chiquitas, primero con FaceTime, ¿verdad? Con videollamadas, después que dejaba que la abuela que trajera a los niños a verlo en el hospital, pero realmente fue algo muy grande porque cambió la dinámica de la relación que él tenía con sus hijos, ya después de que estuvo con nosotros 6 meses, entonces había cambiado la, este, la relación con sus hijos y realmente también la relación con su ex. Entonces, se me hace que es súper importante cuando estamos dando terapia que realmente nos metamos, que tengamos esas conversaciones que son a veces poco difícil, pero que no nos, que sigamos adelante, que les demos fe a nuestros pacientes, que saben que sí pueden cambiar las cosas y para lo positivo.
Reflecting on your 30-year career, what have been the most rewarding aspects of your work in therapy?
Oh my gosh. Well, I think, I think definitely writing that, being part of, being an author in a book was definitely big. In that specific situation, I was the only one with a bachelor's degree that actually wrote part of that book. All of my colleagues were all doctors, so it was a really special thing to me um, that when I was invited to participate, it was really based on what they saw, what they saw, the direct correlation with my patient care, with patient outcomes, and that I was, they also saw that they also felt that, this was 3 or 4 years into it, then they knew that I could do the research. And so I think like for me, that was like probably the biggest milestone that I could say in my career as an occupational therapist. It was very meaningful. I really felt like, my dad had already passed away at that point, but I thought, oh my gosh, like if dad was alive now, he probably wouldn't believe that this book is going to be required reading for every um, um, uh, oh my gosh, for every rehab doctor at that time, that I think the first 2 years after it was published, for every physiatrist resident, it was expected that they read this book. So it was a big deal. Yeah. So I'll go ahead and say that in Spanish. So, como lo que más estoy, I can't remember the word proud. O sea, la cosa que ha sido lo mejor en los 30 años que he estado practicando como terapista, y fue realmente que participé en escribir un libro para doctores de rehabilitación de un fisiatra. Y no nada más que fui parte, que fue autor de este libro, pero también que era yo la única en los restos de mis colegas que no era doctora. O sea, a ese punto nada más tenía mi bachillerato y sabían muy bien lo que yo hacía con mis pacientes, y también sabían que pues yo ya estaba practicando en de que toda la terapia que yo estaba haciendo estaba basado en cosas científicas, y que yo había escrito varios papeles en los estudios que estaba yo haciendo con mis pacientes. Entonces yo creo que eso fue lo más bonito. Ya mi papá ya había fallecido, pero pensé, ¿quién iba a creer que, que yo iba a ser parte de un libro tan importante?
Busqué la palabra orgullosa.
Así es, orgullosa, orgullo o orgullosa, gracias.
It's new for me too. Orgullosa.
Orgullosa, orgullo. I,
Orgullo. Oh,
yeah,
okay.
I just forgot, like I blank sometimes.
Oh. How do you maintain personal well-being and prevent burnout in such a demanding field as yours?
Uh, I mean, that's a great question. And, it's not always as easy, it's not always super easy for me. But I think that one of the benefits of working telehealth is that I'm in my own environment, that I'm able to communicate as much as I want with my colleagues, or I can like shut my computer and I can take like a mental and a physical break. And so, oftentimes when I might actually like finish my day and have a headache, but the other thing that helps me a lot is really maintaining grounding, being grounded with nature. And so, walking outside barefooted on the grass or watering plants, seeing my plants grow. I don't know, I love it. I have a bunch of succulents. I actually, um, I mean, this is crazy. I just started doing this like 3 years ago, but like whenever I go see like a family member, I like to take a little clipping from their house. And so I feel like we have a ranch in Mexico. So I feel like I have like all my ancestors around me. And I know it's crazy, but I have a lot of like, it just makes me feel good. Like I have a plant, my uncle is deceased. He died he died of COVID. And so I asked my aunt, or when I went to see her, are any of these plants, were they Tío Francisco's? And she said, no, but what I do have is I have a flower pot that, I don't have anything in it. And he's the one that gave me the flower pot. And so I took a clipping of her plants and, so that's there. I have, there's a creeping rangoon. I don't know if you guys have those in California. It's a beautiful vine. And my cousin was redoing her house. And I knew that my aunt had planted, it was a huge vine and she didn't want it anymore. And I said, Marianne, you have to save that for me. And it's so beautiful. And so I feel like everybody everybody's different when it comes to stress relief, but for me it's really kind of having a connection with nature and animals. I love my horses. I love our dogs. So um kind of taking them, being able to just put that aside is very important, because if not, believe it or not, there is a high burnout rate uh, with the service delivery of therapeutic interventions, especially in psychiatry. And in that TBI program, we practiced a lot of the 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 psychologist made it. She would do meditation a half hour a day uh, during most of all of our lunch breaks. So she would do an hour, but like, not our lunch breaks were staggered. And so, you could go into it was for her own self-care, but she was providing that for us as well. And that's actually really nice that as a team, she collaborated with us to make that happen. En español, ¿cómo es que con ese tipo de profesión que tengo dando terapias, mantengo mantengo salud mental sana. Y la mejor razón, ustedes que me conocen saben muy bien que me encanta andar afuera, me encanta andar con mis plantas, me encanta andar con los caballos, con los perros. Le digo a Victoria que después de un día difícil, me encanta salir afuera, acostarme en la hamaca o estar descalza y sentir el zacate o césped abajo de mis pies, el pasto, o bañar a uno de los caballos, o estar realmente en la naturaleza. Una de las cosas que me ha apasionado en estos 2 o 3 años es las plantas, al punto de que voy a la casa de la tía y le digo, oye, dame un pedacito de dame una podita de esto. Y tengo la casa, digo, estos son todos son mis tíos, son mis tías, es mi abuela, y se me hace que es algo que me da mucha paz y me siento sana mentalmente.
Cultivas tus vínculos y conectas con tus ancestros con tus plantas.
Así es, y me encanta. Mucha gente puede que diga, oye, estás bien loca, Tere, pero pues está bien, no me importa.
What advice would you offer to aspiring therapists interested in pursuing a multifaceted approach similar to yours?
I mean, I feel really lucky because, the thing about occupational therapy is if you get tired of doing one thing, you can turn around and do something else. If you want to do orthopedics, you can do orthopedics. If you want to do pediatrics, you can do pediatrics. If you want to do neural rehab, then you can do neural rehab. There's so many things that we can do. And so if you, if, and so if you do it right and you kind of spend 3 or 4 years in one thing, then you're able to take that skill set into something else. And that's kind of what happened with me. I started off in pediatrics, working with kids with autism and attention deficit disorder. And I took that skill set into the psychiatric world and into cognitive rehab. And it took about 20 years, right? But it was like a big career shift for me. Now I'm back in pediatrics and I do love it. And now I'm able to take some of what I learned, when I was working with TBI, I really learned a lot about neurochemistry, what happens, brain function. And so, it's led me now to really be able to, like, I knew about attention deficit disorder at the beginning of my career, but nothing compared to what I know now and what happens. Again, I think because occupational therapy gives you the ability to really look at the whole person, to take a multifaceted approach to treatment. It's kind of ingrained in us. That question, I wonder how I'm going to do that, translating that in Spanish. I'm going to have to look at it. Okay. And so my advice to a budding therapist is maybe every 3 or 4 years, it's okay for you to explore different areas. You can keep your main career and do home health or work PRN or part-time somewhere else so that you continue your skill base. Victoria me pregunta, ¿qué le dijera a un terapista nuevo que está interesado en el tipo de terapias que estoy haciendo y mi experiencias que realmente es que pues hay varias, I can't think of multifaceted, que no es nada más en una dimensión. Y lo que le estaba diciendo a Victoria, que una de las cosas más bonitas de mi carrera, de mi experiencia, es de que realmente en terapia ocupacional tienes tienes la oportunidad de no nada más trabajar con niños, sino también con adultos, que no nada más es ortopédica, que puede ser cognitiva, que puede ser en neurociencias. Entonces, que tú misma no te pongas tus límites. Puedes estar trabajando en una escuela de lunes a viernes y hacer algo de home health o algo en un hospital un día en las tardes o en los fines de semana y hacer totalmente algo diferente, estar trabajando en un hospital, por ejemplo, y eso te ayuda a aprender más pues de este mundo de terapia, ¿no? Los límites que están son los límites que tú misma te pones. I was just saying, like, the limits that there is in our career field are the limits that you put on yourself. And to be honest with you, I kind of feel like that's true for everything in your life. You know, we are so powerful, and if sometimes we don't give ourselves that opportunity to explore those things out of fear and anxiety of failure. But the truth is, like, you know, so many people that are successful, you know, like scientists or even financially successful, they may have tried something 100 times before they got to 101 and it really worked for them. And so being able to, like, the only limits that we have are the limits that we set upon ourselves, I think. But I am lucky that my career is able to give me a lot of variety.
La palabra es multifacético.
Multifacético.
Oh, sí.
Okay. Oh, esa es una difícil. Okay. I mean, I can do it sometimes when it's like just like the one word, but then when I'm in conversation, like sometimes I'm like, how do we get that, like those multi-syllable words?
You co-authored a paper on a community reintegration model for polytrauma. How have you translated that research into real-world practice?
So interestingly enough, it was actually kind of the other way around, right? So in the Polytrauma Center or the PRC or also the PTRIP, that was the community integration. You know, actually, first it was my treatment, and because it was, like I said, funded by the VA and the Department of Defense, we were expected to keep a lot of data. And you know, the doctor that I worked with at the time, just like a genius, and really wanted us to publish this book because he felt so strongly about the research outcomes that we were getting out of functional tasks. And so one of the things that I wrote about was the you know, it doesn't always happen, but I was lucky enough that we were, you know, that I came up with a protocol to let them, like to really let us be out in the community. And so, for example, you know, you could be practicing a skill in the clinic. You know, I'll give you an example of something that, you know, we had a guy that actually had, a very young guy who had a stroke. And so he didn't have full use of one side of his body, and he knew what he wanted to say, but the part of the brain that was damaged during the stroke was not he couldn't say it. None of the words were coming out. So he had to use an iPad for communication. And so, you know, when we were sitting in a chair, no problem, he was able to do that. When we were, you know, standing at the table and he was using, you know, we were working on balance, he was able to do that. But can you imagine when you're at Starbucks and you're trying to order something, how hard that was? And that's where we started doing some of our outcomes, right? When we started taking our guys out into the community and really seeing is what we're doing in the clinic gonna look the same when we bring him out into the community? And so that it was actually kind of crazy, because first it was the chicken and then we wrote about the egg, right? First we had the outcome. We were working on those research outcomes just to really keep track of, is this really working? And it worked so well that we decided to write a book on it. We decided that when we were doing community integration with cognitive rehab, that it was super important to recognize where our patients were going after they were done with us. And so that's where it was born. La pregunta que me dice Victoria es que qué tipo de research, otra palabra que no me acuerdo muy bien, tomó para poder escribir el libro. Y lo que le estaba diciendo es que, did you find the word?
Google says investigación.
Sí, sí, o sea, investigación de ciencias, pero la verdad es que realmente pasó al otro lado, que primero hice la investigación científica por el tipo de programa a lo que estaba yo trabajando, y después escribimos el libro. Y lo que fue en investigación científica era que lo que estábamos viendo en la clínica se podía traducir o, o que siguiera igual en la comunidad. Y lo que nos dimos cuenta es que sí, que parte de la terapia a regresar a trabajar a la comunidad era que teníamos que practicar en ese ambiente, que no era suficiente que lo hiciéramos en la clínica, sino teníamos que salir a la comunidad para ver qué tipo de problemas podíamos tener, porque trabajar en el balance en una mesa, en una clínica, es muy diferente que estar en la comunidad cuando hay bastante gente, cuando hay escaleras, cuando está así de chiquito entre los carros, todo eso tiene que ver. Entonces, pues fue una parte muy bonita que me da mucho gusto que todavía, que esos estudios científicos que hicimos, esas investigaciones científicas que hicimos, es como realmente como nació el libro.
What assessments or interventions do you find most effective for clients with ADHD or brain injuries, and why?
I think so with both, well, with brain injury, any type of executive function assessment is going to be your best bet. And then, there's also the component of clinical observation. And so when it comes to brain injury, once they're quasi ready, is really, to me, the best assessment is taking them out into the community and creating almost like a task analysis and what it is that you want done. So, I'm going to drop you off at the grocery store. You're going to have $20 and you need to figure out how to make, 2 meals with those $20. And then and then looking at the whole, everything around that, are they able to meet that criteria? If they're not able to do it in 20 minutes, why? Was it because there was a loss of balance? Or was it because there was, they forgot, or was it because of something they forgot ingredients? Or was it because they forgot or because they went over budget, they couldn't figure out the money situation? And so putting up, taking to me, that assessment part, once you're in therapy, or so it's almost like a reassessment, or almost like, are they ready for discharge, is testing we do what we need to do to create our treatment plan. But afterwards, what's our best guess if what we're doing is going to work is actually trying to see if it can work in the real world, in real world situations. When it comes to attention deficit disorder, I kind of think that it's not, there's a lot of assessments out there, but it's about the treatment plan and about when you're doing these executive functioning assessments, what's popping out at you? Is it short-term memory? Is it organization? Is it planning? Where is it that they're lacking? And so that when you create that treatment plan, is the treatment plan creating sustainability and accountability? Because at the end of the day, the person with attention deficit disorder might do really good at an assessment, but that doesn't mean that they're going to do real good in real life, because as we talked about, a lot of people with attention deficit disorder have high IQs. So when they sit for that assessment, they actually might do really well. And the real nitty gritty is in function. So I'll go ahead and try and say that in Spanish. ¿Qué es la evaluación que es más importante o que yo veo que me trabaja mejor cuando estoy trabajando con gente que tiene TDA o gente que ha tenido un accidente cerebral? Y la verdad que para mí no realmente es en la evaluación, sino en el plan que hacemos para, por ejemplo, con alguien que ha tenido un accidente cerebral y que ya ha estado en terapia, que las intervenciones que le has estado dando, que si las puede llevar a la comunidad, que si lo que estamos haciendo que si realmente va a ser independiente en las actividades en la comunidad y cómo es que se ve. Entonces, si hay la oportunidad de que tú vayas, por ejemplo, si tú vayas al mercado con ellos y les digas, te voy a dar $20 para que con estos $20 compres comida para 2 platillos, ¿qué es lo que estás viendo? ¿Cómo está el balance? ¿Pueden contar ese dinero? ¿Se acordaron de todos los ingredientes? Entonces, de tener un tipo de evaluación, a lo que yo dijera funcional, algo de todos los días. Y con el TDA, una de las cosas que nos tenemos que acordar es que muchos de estos niños o también adultos tenemos un rango intelectual más o menos alto. Entonces, no es que no podamos con la prueba, pero ¿qué es lo que estamos haciendo de día a día? Entonces, realmente es más del plan de terapia que estamos haciendo. Cuando hacemos estas evaluaciones, si tú sabes que ellos están batallando con organización, con planear las cosas, con acordándose de las cosas, entonces lo más importante en completar en seguir adelante, no es realmente, es en que sigan adelante, es en el plan que traemos de terapia.
How do your bilingual skills, Spanish to English, enhance your ability to serve Hispanic or marginalized populations?
I mean, I think it helps as far as when I have a Spanish-speaking client or a parent or a family member, because sometimes you might have somebody in a hospital bed, which has happened to me before. Actually, my Marine spoke perfect English, but he was a first-gen kid, and so his family really, he initially started with me. He was in a drug-induced coma because we were trying to stabilize him. And so it was really more about meeting the needs of the entire family at that point. And so that's one way, is that there's a certain connection that you build when you're able to talk to someone in their native language. And I'm so grateful that I have the ability to be bilingual, and that even right now at ASU, I have 3 or 4 bilingual. I have the kids speak English, but the parents prefer to have a bilingual therapist because they want to be able to communicate with that parent. They want me to be able to communicate about their child's progress. And I think also there is a little bit of like the understanding of culture and the Latin culture, even though every Latin culture is different, there's definitely some similarities in it, you know, as far as that family is very important. There's also like certain beliefs of cultural beliefs that are also important to take into consideration. That doesn't mean that they're right or wrong. It just means that you should consider them as you're delivering treatment. Victoria me estaba preguntando que cómo es que yo pienso que ser bilingüe me ha ayudado en mi carrera. Y pues la verdad que pues estoy orgullosa de poder usar mi lenguaje, pues es seminativo, la verdad, porque aprendí inglés y español casi al mismo tiempo. Yo creo que realmente domino mejor el inglés, pero pues es de poder conectar con mi gente. O hay veces, como le estaba diciendo, de una historia de un muchacho que estaba en el ejército, que él estaba en coma, entonces no realmente era importante para mi paciente, pero era importante para su familia, que ellos solo hablaban español, de poder comunicarse con alguien en el equipo médico, que ellos se sintieran, que pues podían platicar bien con ellos, ¿verdad? Y hasta ahorita en mi trabajo, no es que mis niños no entiendan inglés, sino hay veces que me piden que sea yo la terapista simplemente porque el padre se puede comunicar mejor conmigo. Y también pues siendo latina, esa cultura es muy diferente a la cultura americana. Entonces, pues de tener un poquito de que sé realmente cómo son las cosas más que nada en la cultura mexicana, pero igual en todo Hispanoamérica. Absolutely. So when I was a very young therapist, working in South Florida, they give you kind of sometimes the toughest populations as being a new therapist. And so there was a migrant population, and this was, if anybody looks it up, they're going to know it's Indian. There was a lot of there was a big cluster of Guatemalan people. And so I remember the speech therapist, and I knew a little bit about the Guatemalan culture just from like friends that I had. And so, yes, they speak Spanish, but they also have their own native tongue that they have. And Conjubal actually has like, I think something like, it's crazy, like over 70 different dialects or something like that. And so Beth said, I'm having a really hard time with this kid doesn't want to look up at me. And I said, are you trying to get the kid to look at you? And she's like, yeah. I said, well, it's a sign of disrespect in the Guatemalan culture for a child to look directly into the eyes of an adult. And so it blew her away, right? And this was 30 years ago, maybe 27 years ago. And the importance of really kind of being well-versed in cultural diversity, because these are things that, your Anglo-Saxon person may not realize. But I do, I think today's, I don't want to say political climate, because that's not really it, but today's world is making us be more, we're much more culturally diverse, and therefore you know, it's important that you're actually culturally versed. You know, that doesn't mean that you have to fully understand it, or it doesn't mean that you have to, I take that back. It doesn't mean that you have to participate in it or you have to believe it. However, I do think it's important that you recognize the importance of cultural diversity and what it means as a practicing therapist, you know. Me estaba preguntando Victoria que qué es lo que pienso yo ahorita de la cultura, de diferentes culturas y trabajando con diferentes culturas. Y pues le estaba diciendo que para mí es súper importante porque, o sea, como terapista yo debo de darme cuenta de lo que está pasando con mis clientes. Y le estaba dando un ejemplo de que me pasó hace como 27 años, de que estaba yo trabajando en una región de Florida que había mucha gente guatemalteca. Y pues me pregunta la terapista de lenguaje, oye, no entiendo por qué no me quieren ver los niños a los ojos. Y pues yo ya sabía porque yo tenía una amiga guatemalteca que pues los niños es una falta de respeto si tú ves directamente a un adulto en los ojos. Entonces, pues pues fue una conversación muy chica, la verdad. Oye, pues no puedo, no me quieren hacer caso, les trato, quiero como hasta levantarlos de aquí, ¿verdad? Y le digo, pues Beth, lo que pasa es que en la cultura guatemalteca es una falta de respeto ver a alguien directamente, o sea, de un niño a un adulto. Y eso cambió como Beth estaba dando terapia, ¿verdad? O sea, lo que se dio cuenta que estaba exigiéndole algo a esos niños que pues que es realmente una falta de respeto. Pienso que en el clima de hoy es súper importante como terapista o cualquier persona profesional darte cuenta de dónde viene la gente, de qué tipo de cultura crecieron, de qué es como lo que creen ellos. No que tú tienes que creer todo lo que ellos te están diciendo, sino de que tú tienes una responsabilidad de estar lo más informado para que tú puedas dar y ellos puedan recibir lo que les estás dando. That was a really good question, and I do think like in order for you to be successful as a therapist, you need to consider all of those things. And it doesn't have to be just the Latin American culture. I think that there's also societal norms, you know, and there's also, you know, going from living in South Florida to living in Texas was very different. That was culture shock for me, to be honest with you, even though I went to, I'll just tell you this, like, I was born in the United States, but I lived in Mexico until I was 6. And then I was in South Texas until the age of 12. And so when I moved from South Texas to Florida, it was complete culture shock for me because most of the people that I grew up with were Tex-Mex. So, you know, maybe there was like 3 Anglo kids in school and like 1 Black kid, and everybody else was Mexican. And so that alone was culture shock for me. You know, fast forward, you know, 40 years later, and I love learning about different cultures and traveling and really digging deep into living as other, you know, just absorbing other people's cultures and taking the best out of each of them.
Oh, did you want to translate that in Spanish?
Le estaba diciendo a Victoria que pues realmente en el día de hoy es como tan importante porque nuestro mundo se ha hecho muy chico, de darnos cuenta de dónde viene la gente y cómo es que nosotros podemos conectar con ellos. Por ejemplo, cuando yo me fui, o sea, no fue mucho cambio para mí de chica de los 6 años moverme de México al estado de Texas, pero a los 12 años cuando me fui a Florida, que realmente yo, pues ahí en el valle, como nos gusta decir, ¿no? Decir, este, pues eran todos casi mexicoamericanos. Entonces había como un negro y como tres, tres, este, tres gentes realmente angloamericanas. Entonces, cuando yo me voy a Florida, pues fue una sorpresa, en verdad, fue un shock, porque pues yo misma realmente había vivido en un como círculo de cultura, porque hasta la cultura mexicoamericana o Tex-Mex es muy diferente de la cultura mexicana tradicional y mucho, muy diferente a la gente latina de Florida, porque en esa cultura pues estamos hablando de cubanos, de puertorriqueños, de venezolanos, entonces pues es muy diferente, la verdad, pero creo que es lo que nos hace, que es lo que hace el mundo tan bonito, es de poder aprender de diferentes culturas para mí me encanta viajar, me encanta este, pues tener diferentes experiencias entre la cultura.
What continuing education or certification do you hope to pursue next?
So I'm currently thank you for asking that because I'm like excited that I'm working on becoming a licensed marriage and family counselor. And this really kind of came about again during the pandemic and all of the personal growth that I was able to take. You know, there was a lot of life changes that happened for me, some good and some bad, but you know, to be able to reflect on that and to be where I am today with my children, with my husband, with my friends, and just the world that, you know, I feel so blessed to live in. And so part of that is I'm kind of like a lifelong nerd. And so I'm excited to see what comes next. You know, hopefully I should be done in about 2 years with this advanced certification. And I'm eager to see what's next, you know, because working as an occupational therapist in teletherapy, I'm able to really connect with the parents, and I started really seeing the, you know, the struggle. I recognized their own struggles and the struggles that I had raising two children with attention deficit disorder. And I wish that there was a therapist then that would have been able to guide me the way I hope that I'm able to guide families in the next couple of years. So me estaba preguntando qué es lo que sigue para mí con mi educación. Entonces, pues, le estaba diciendo que ahorita estoy tomando este programa de ser terapista de matrimonio y de familias, que realmente pues estoy súper encantada de poder hacerlo, porque cuando yo estaba, ahorita que estoy practicando como terapista ocupacional, veo las cosas, los problemas, el dolor que a veces los padres tienen cuando están porque lo hago por videos, entonces pues veo más a los papás y veo lo que batallan y que realmente ahorita no tengo la herramienta al 100% de poder darles lo que necesitan, pero que pues muy pronto voy a poder hacer eso. Es algo que es como que está dentro de mi corazón porque pues mis dos hijos tienen TDAH o déficit de atención y sé que si hubiera alguien en ese tiempo que era experta en TDA y que también sabía cómo dar terapia para familias, que puede que hay algunas cosas que se nos hubieran facilitado, porque realmente no tenía yo la dirección de dónde empezar, de cómo darles a mis hijos lo que ellos necesitaban cuando por yo misma, porque pues yo también tengo déficit de atención, no sabía dónde empezar con eso. Entonces, pues espero que muy pronto pueda pueda dar, que voy aprendiendo para ser experta en dar terapias familiares y con matrimonios y especialmente con niños. O sea, va a ser un rango muy grande, pero especialmente con las familias que batallan o tienen el diagnóstico del TDAH.
All right, one last improv question. What do you hope to see for the future? And this can be very generally. This can be relating to your specific therapeutic practice and profession. This can be in regards to how you would like to see the growth of families in society. This can be personally your own goals for the future, but the general question is, what do you hope to?
I think for me, like, you know, I'm learning how to like really advocate for myself, how to set boundaries. You know, this program is helping me do that. And also like, you probably don't know this, but I don't think I've shared this with you, but part of the reason I started doing the TikToks is because I know there's a project that's coming out in my curriculum for advocacy. And so it's really kind of helped me empower myself and trust my skill level a little bit more. And so hopefully being able to, you know, to share some of these information and these experiences that I've had as a therapist and also as a woman. And so, you know, how fun is that to be able to learn to mesh what you know as a person, to be able to share your personal growth and also your professional growth to make things happen. Entonces, Victoria me está preguntando qué es lo que quiero en el futuro. Y pues la verdad es que para mí, este proceso, como yo y Victoria nos conocimos, fue porque empecé a hacer TikToks y es realmente parte de un proyecto que estoy haciendo, siguiendo esta certificación, pero la verdad es que es muy bonito porque me da la oportunidad de poder conectar con la gente a un nivel profesional de las experiencias que ha tenido los últimos 30 años, pero también al mismo tiempo de lo que ha pasado en mi vida personal y cómo es que vamos creciendo, ¿verdad? Entonces, de poder empoderar a la gente, especialmente la gente latinoamericana, y de poder conectar con ustedes, con el mundo, a un nivel profesional y a un nivel personal para mejorar nuestras vidas. No nada más, por favor, no crean que creo que soy una persona perfecta. Esto es un proceso de crecimiento que pues realmente es muy bonito y qué padre que pueda hacerlo con ustedes también. So I was just saying, because I forgot to leave this in the English part, like it is like a really beautiful thing that even though this started out as an advocacy project, to be able to share the information that I have, like from a professional level and a personal level, and know that I'm not done, right? That like to be able though to share your personal growth and your professional growth with the world is like such a beautiful thing because it helps you reach people that maybe weren't being reached before. And so, you know, it's very exciting to be able to do that. And I hope to continue to do that.
I'm really looking forward to sharing your content and hoping that the people who would benefit from learning from your experience are magnetized to you.
I hope so. And I'm actually, like, I was talking to my kid and he's like, Mom, you need to build like a YouTube channel. Like you need to, like, he's kind of guiding me in some of this stuff. And so I can't wait for that to come out. So I'm able to kind of share your stuff and my stuff together. You know, it's so crazy, right? How like sometimes people connect and the things that happen afterwards. And I do kind of you know, looking at some of your content, like it's crazy because I just feel like there's so much more that we could potentially do in the future where it comes to like your podcasts, right? Because like my experience working for Department of Defense, and so when you were talking about, you know, what happens with the programming, this is something like for me, like I, you know, like I thought about so much, like we are taking these brains that are not fully developed yet at 18 years old. You're being told what to do and what to think. And so when you come out of that, you're not even sure where to start. And so, you know, there's a lot of stories, or even stories from that mental health unit. Like there's so many crazy stories. I would maybe not say exactly where. Well, I guess it doesn't matter. It's been close to 15 years since I no, it's been about 6 years since I worked with them. But in the psych ward, it's been a good 10 years. And there's just like some really crazy stuff that is it would only happen in the military.
You know, just by seeing the cases in regards to soldiers who specifically got in trouble and then went to the jail. I had worked at the jail in Washington State, and then got to see like records of across the board, soldiers are heavily traumatized, and unfortunately, this carries out into families.
Absolutely.
Yeah.
No, you know what? So I had to, like, part of my last course, I had to interview family therapists, you know, marriage and family. And I was very surprised. It was one of because, you know, they're like generated questions. And so one of the questions, kind of like what we just did, was, you know, what's most of your caseload? Like, what does your caseload look like? I think it was like, what does your caseload look like? Do you know, it was like about 60% military or retired veterans or families, because, you know, that PTSD plays heavily on the family unit when they come home. And they don't always make it, you know. And so, yeah, we'll have to figure that out.